Oh my gosh. Hello, everyone. I didn't realize that I was having technical difficulties because I'm in the office instead of at home, but I'm in my operatory. Hello, everyone. Maybe everyone is still here. All right. So today in the live, obviously it's Tuesday. Oh, hi, Rock Simmer. Yay. Hi, dear. Hello, everybody. Sorry about that. I'm trying to set everything up and it took me a little while to get everything together, but there's still patients in the office and I figured I would start in a little bit. Hi, Gal for God. Roxanne, same thing. All right. So today I'm not going to be able to stay very long. So I'm going to be talking hi, Mitch. Hi, Cubs fan. I think you asked the question. Sorry. So I want to jump right into the questions today because I don't have a lot of time. I just want to make sure that I'm able to address all the questions that I got. I've been getting like better and better questions every week. And some of the questions, it's really hard to describe completely on my comments. So let's start right away. I'm actually going to start with Adir's question because Adir asked a question about scaling and root planing. Scaling and root planing is deep cleaning. It took me a while to try to figure out what you meant by that. But when you say root planing, that basically means that you're going to be cleaning the roots of the teeth. So when you have gum disease or if you have a little too much plaque on your teeth, then we do something called scaling and root planing, which just means we're going to scrape it all away. There's two kinds of cleanings. Oh, I will answer that in a second. I love doing live on webcam because I can read these questions as I go. So I don't want to forget this. So scaling root planing, we numb you because we're going below the gum as opposed to in a regular cleaning, it's above the gum. So it is supragingival versus subgingival. So supragingival is everything above the gum and subgingival is everything below. So everything below is what you're going to get in scaling and root planing. Now, sometimes we can get away with not numbing, but the reality is it can get quite painful. So it's really important that we numb you to make sure that you don't feel anything. But after that, and the most important thing I tell everyone is that after you do a deep cleaning, you want to make sure that you continue to go back for maintenance, because if you don't go back for maintenance, all the plaque buildup is come back again and build up all over. I tell people all the time, it's like if you take a really good shower one day and then never go back and take another shower, that's never going to work. You have to make sure that you're constantly maintaining, and that's why we call it periodontal maintenance, the deep cleaning that you have gotten. I have some people, they like to say, oh, I just want a deep cleaning. I'm like, it doesn't work like that. You don't just request a deep cleaning. Deep cleanings are things that you do when they are needed. I haven't done a video about gum disease and periodontal disease in a while. It's probably overdue because it's such an important topic. It is the foundation for everything. You cannot have healthy teeth without healthy gums and bones. I hope that I answered that question. Cubs fan asks, what drug do you give in IV sedation? IV sedation uses a variety of drugs and medications. Some are fentanyl. Sorry, I'm getting a question. Okay, do you have keys? Sorry. So fentanyl is one of them, Valium. Now, they're not the typical Valium that you use when you take a pill. It's a lot stronger when it's IV. I was just talking to a patient the other day about, is what dangerous? Yes. Talking about IV sedation. So those drugs, they can be very strong. They're not to be used lightly. A lot of people like to throw around the phrase, just put me to sleep. And when you say just put me to sleep to somebody, you have to be very careful. If you ever hear anything in the news where someone has a bad effect during a dental appointment, it's usually IV sedation and sedation related. It is safe, but usually the complications of dentistry don't have a lot to do with actual dentistry. It's not like a root canal gone bad and somebody gets an infection and something bad happens to them. I don't even want to say dies, but if something bad happens to them, most of the time it is something related to getting put to sleep and not waking up. Now, that is not common, and that's why you hear it on the news, but it is raise the level of, I didn't know if that sound is causing a lot of noise in the background, raises the level of difficulty when it comes to doing a dental procedure. Now, the benefit, of course, is just because you're not going to remember a thing. And if you know anybody who's ever been put to sleep having a dental appointment, they don't remember the next day. They have no idea. And during the dental appointment, if you saw them, you would think that they were awake and responsive because we still ask them to open, close, and all those things. They just have amnesia. They don't remember anything, which is very interesting. Should you see, Divine Food says, should you see a dental hygienist first and then have a checkup? The answer is it depends. In my office, we've done it a variety of different ways. I have hygienists who've been hygienists for 20 years plus, and they're pretty good. If there's anything that would have stopped them from doing the first cleaning before I see them, they usually let me know. You would be surprised that some people come in with teeth that move so much that if the hygienist cleans them, they may fall out. I know that sounds kind of crazy, but that happens all the time. But for the most part, if you have a fairly healthy mouth, or even if you have gingivitis and some gum disease, it is safe for the hygienist to start your cleaning before the dentist sees you. Now, depending in my office on what's going on, we're always in communication. I always know what's going on. So if there's anybody that needs to see me before the cleaning, then we do, but it usually happens the same day. So I can make sure that I verify the diagnosis. We look at the rest of the teeth and make sure that we agree on what the treatment plan is, not only for the teeth, but also for the gums and the bone. Very, very important. Is what dangerous, Adir? You have to clarify the question. Hi, Mitham. I always want to say that. What is most important for dentists to know? Oh, wow. That's a big question. What is most important for a dentist to know? Oh my goodness. Do you want me to take my 12 years of practice and my 4 years of dental school and put it together? I was at the dentist today and they said I should either get a filling redone or have a crown because I have a lot of fractures on the tooth. Mitham, can you clarify that question so I can answer that question? Because I have a lot of fractures on tooth number 14. I was wondering if it would be okay. Now, if you have pain on a tooth that is cracked, okay, if you have pain on a tooth that is cracked, you want to be careful because depending on the level of the crack is whether or not you will ever feel comfortable again. Once you have biting pain, all of the alarms in my head go off because I start to think cracked tooth. And once you have cracked tooth, we don't know. Now, I always like to start with the most simplest way to fix something before we go into the most complicated way. So I always recommend if the dentist thinks that a filling is worth it, if the dentist thinks that it is worth it to a filling, then they do a filling. If they think that it's beyond and you need a crown, get the crown, because a cracked tooth, if the crack extends from the top of the tooth to the bottom of the tooth, your tooth is a goner and you're going to need an implant. So I would do whatever they suggest to prevent any more cracks, because cracks is why I have dental implants. If I didn't have cracked teeth, I wouldn't have dental implants at all in my mouth. And that's clenching and grinding is the cost for me, but that's a lot of different people. Most people, clenching and grinding, it weakens your teeth over time. And then what eventually happens is some minor small thing like eating something soft and the whole thing just goes crack and then you're done. Now, cracks can't always be visualized on an x-ray. Most of them, my way to diagnose them is symptoms, biting, pain. Adir, no, there are no negative effects. I mean, I can't say that. There are negative effects to scaling or root planing, but they're very minor. And the negative effects usually have to do most with post-operative pain, meaning after you're done, you're going to be sensitive. It might hurt to bite down and chew, but because it's local anesthesia, the chance of something bad happening to you is very, very low. It is not a fun appointment for the most part, but the most important part is that you're numb. And if you're numb, you can do anything. That's not usually an issue. There was another question. Someone was asking me this week about whether or not when you wear clear aligners like Smile Direct Club, if that causes recession. That is a tricky question because most orthodontics, you're welcome, my dear, most questions, most movement of your teeth may cause recession. And the reason that I wanted to answer this on live instead of saying it in a comment is because I got to demonstrate. So imagine these are your teeth, right? And they're all spread apart, or maybe they're all jumbled up, and you want to move them. When you move them, not only are you moving them, but your gums move too. So if your gums are sitting down here, your gums are also moving as your teeth move, and that may pull on the gums and cause recession. Now, usually that recession is not so dramatic that it's like bad, but it can happen. The other thing is when you wear clear aligners and they're on your your gums, it's rubbing. So sometimes the end, and I like to use models. Every time I'm talking, I always feel like searching for a model. The end of the liner, like if it ends right at your gum, if it rubs and rubs and rubs, can also cause recession. And that recession which basically means your gums drop away from your teeth, can be damaging. But that is different for everyone. That is not something that is predictable. And I won't say that that is something that common. So I wouldn't be overly concerned about that. I forgot the name of the person who asked that question, but I'll make sure to make a note of that at the end. So Mitham says, what is the procedures that a general dentist can do himself as opposed to refers to a specific dentist? Okay, so you're talking about general dentistry versus specialty dentistry. So let me give you an overview. If you haven't watched my videos before, you'll know that I consider myself a super GP. That means that I do a lot of procedures that not just trying to see if I can get some better lighting here. Not just that general dentists can do. Sorry, I was reading my next question. I'm going to answer that in question. I do not only what general dentists do, but I do some specialty procedures. So let's go through the basics. Maybe I'll remember everything off of the top of my head. So exams, x-rays, cleanings. I don't do cleanings. My hygienist does cleanings, deep cleanings. That all happens in the general dentist's office. And then we do fillings, crowns, bridges, dental implants, dentures, partials, sealants, root canals, extractions, wisdom teeth extractions, pulling teeth of all sorts, some minor gum surgery. And I'm pretty sure I'm missing. I know I have some dentists who also follow me too. So if you want to chime in and I've missed some of the procedures, you did it. No, it's fine. I'm sorry. I'm responding to the messages on the sign. So those are our basic procedures. Now, every one of those procedures can get quite complicated. So let's use wisdom teeth for an example. Wisdom teeth, there are certain kinds of wisdom teeth that are very, very impacted. I'm a little different because I say if I can't pull it, you shouldn't have it pulled at all. That means that if I can't pull it, that's because I think that somehow the disadvantages outweigh the advantages pulling it. So if I think that your wisdom teeth is sitting on the nerve and you have a high chance of nerve damage, which is one of the questions that somebody asked us earlier, which I'm going to respond to, why would a oral surgeon who's a specialist pull that tooth? Because they can also damage you too. So what's the difference between them damaging and you damaging? And how about nobody damage you? It has to be worth it to do something like that. Pretty much if you're after the ages of like 20 something and you're in your early 30s, I think very hard before I consider pulling your wisdom teeth, because I don't want to cause you any unnecessary. Now, I take out wisdom teeth on 65-year-olds, so it doesn't really matter, but you don't really want to do a procedure you don't have to do. So specialists like an oral surgeon. Another specialist is a periodontist. A periodontist is a gum specialist, and the gum specialist typically is going to do with severe gum disease. But again, if I can't treat you, this is my personal philosophy, by the way. So not all dentists agree with me. If I can't treat you with severe gum disease, that means maybe your teeth are not worth saving. Maybe you save your trip to the periodontist, which is going to charge you thousands and thousands of dollars for things that they are not sure is going to work. And maybe we should come up with other alternatives if your teeth are not savable with gum disease, if that makes any sense. Sorry, we're still in the office. And then the other specialty is orthodontics. Now them, I give them all their props because orthodontics needs a specialty because they deal with growing kids, and a general dental office doesn't typically have the time to address all of the needs of someone who is a child who is growing and changing their teeth. Now, clear aligners are really awesome for adults. Yes, teenagers do clear aligners too, but clear aligners for adults works really well. Clear aligners works even better for someone who is relapsed. That means that they had braces when they were younger, and then now they need braces again. And usually those are minor tooth movements. So oral surgery, periodontist, who's a gum specialist, orthodontist. Then we have prosthodontists. Prosthodontists do complicated crown, bridge, denture cases. I know I'm missing some sort of special. Endodontists. Endodontists are root canal specialists. For example, I don't do root canals on upper molars. They can get quite complicated. Sometimes they have 4 canals, 5 canals. Very complex. So I choose when I send somebody to a specialist. So I think I covered all of the specialties: endodontics, oral surgery, orthodontics, periodontics. That's 4. There is no specialty in implants, by the way. I consider myself an implant specialist because that's what I do all the time. Mitch says that he doesn't have tooth pain, but they saw a lot of fractures. That's a tricky one because depending on where the tooth is, you can get away with the filling, but I'd be very conscious of it. And if they feel like if you have an existing filling on your tooth and that existing filling is large, I would recommend a crown. Now, if it's a small existing filling and the cracks are minor, then do the filling. Do the filling, don't do a crown. So I hope that helped. I hope I didn't complicate it too much. It's really hard for me sometimes to answer questions without looking at x-rays and seeing you I call myself a dental investigator. Sometimes I ask my patients so many questions. They're like, whoa, I didn't know you were going to ask me that. I send people home with homework. I said, go eat something and see where it hurts for real. Don't, everybody's guessing, but we don't want to do that. Yay. Hopefully that helps a lot. I'm a superhero. Where's my cape? All right. I wanted to answer another question that somebody asked, and this one is a doozy. They were asking about nerve damage. Now, nerve damage is something that every dentist, is horrible. So there are certain procedures, especially procedures at the bottom, and I think I talked about this on my needles video. When we do a block, that means we are going to numb your lower half of your jaw. We numb you all the way back here, and then it numbs you here to the middle of your lip and gets your tongue numb on that side. That's why you talk like this, blah, blah, blah. So we do all of that. And when we do all of that, if in the process of doing an extraction, for example, they bump into your nerve, they do something that causes nerve damage, some people, after the anesthesia has supposedly should have worn off, still have numbness. That sucks. Most people do not retain the numbness in their tongue, even though that happens too. But a lot of people will feel numbness in their chin area. So when they touch, they're like, I have a couple patients, not from me, from other people who have permanent numbness in their chin and that area. This is probably the worst side effect when it comes to a negative outcome, when it comes to dentistry. Most of the time that's related to something wisdom teeth related, even though there are some other procedures that come close to the nerve. I myself, if I think I'm even close to the nerve, I'm out of there. I will tell the patient we will not touch. I will tell the patient I'm sorry. I'm tell the patient we're not there. Nobody fully understands why I'm saying no, but I'm saying no for your own good. If I say I cannot do something for you, or if I think we should stop our procedure, it's because I don't want to harm you. And now nerve anesthesia, we call it paresthesia, or we can also call it dysesthesia. And dysesthesia basically means that you get these weird electrical shocks in your face, and which can be quite uncomfortable. And it's I went to a continuing education course a couple of months ago where a specialist who actually does when people have mastectomies and things like that, help to kind of reinnervate the nerves to the nipple, also does procedures for the mouth to help reconnect nerves that are damaged during dental appointments. And before, it used to be something that dentists used to say, I'm so sorry. I guess you have to live with this pain for the rest of your life. But now they have new technologies, microsurgeries that can help people regain their nerve sensations in their face that they have lost. Now, also, they can reduce those pains and those weird sensations that people get in their face from that. But the most important thing when it comes to all of those things is timeliness. I thought I just saw somebody walk by. Timeliness. If something like that happens after a dental appointment, it's very important for your dentist to tell you as soon as possible to make sure that, hey, Patty. Hello. As soon as possible to make sure that you get that taken care of. You're done for the day?
Yes.
All right. Have a good night. Bye. See you tomorrow. Sorry. When I move back and forth like that, that's why it gets focused and out of focus. Okay. Looking for the light. So yeah, that's really important. I know that was a question that somebody asked. If nobody has any questions, I'm going to go really quick to my comments and see if I answered everybody else's comments. Yes, I answered that. Oh, I'm good today. I think I got everybody's question. Yes, I think I got everybody's question. Man, that was fast. That was fast. Hollywood Star 2000. Yes, That's what I was just talking about just now. So Hollywood Star says that his sister needs to get a root canal from a specialist because the general dentist referred them. Now, second molar root canals are much more complicated, and that's what I was saying before. A second molar on the bottom is not as complicated as the second molar on the top. So that, I wish I could demonstrate something. So let's imagine these are the roots. Okay, these are the roots. It's almost like, I say, like a Joker hat. Like a Joker hat, they look like this, the upper roots. This is the palatal root, the one near the roof of your mouth. And then there's two on the sides. Now, one of these, sometimes they have a double. So they have two nerves inside of one nerve in here, one nerve, and even sometimes a fifth nerve. So, and endodontists, they use microscopes. So, well, a lot of endodontists use microscope, at least the one I refer to. And it's kind of cool because, like, you'll have one person sitting here, the dentist sitting here, and the assistant sitting here, and they're both looking into the microscope at the same time to look inside of the tooth, because literally it is so tiny, looking into that little channel, and then they can find all the nerves. The most reason that I refer those out is really because to be honest with you, it takes a lot of time to find all those nerves. And the other ones, I can find them in just a little bit. See, I see my root canal stuff right here. Because I do rotary endo. It has nothing on here, so there's no spinning. Mitham says, how the deep caries reach. Oh, how do you, okay, so I hate talking. Oh, I wish I was your dentist too. Where do you live? Listen, everybody come, make a field trip, come to United States. I forgot if you're in UK or if you're in Israel. So if you have, sorry, I'm still looking around because I'm always looking for some example. Okay, so we're going to visualize this together. This is the enamel, which everybody knows. Inside is the dentin. Inside that is the pulp. The pulp is where the nerve lives. The pulp is where the blood lives inside of your tooth. So if you have enamel, dentin, pulp, when you're in enamel, you're not officially having a cavity yet, because we still can call that what we call incipient decay. That means that some people with really good hygiene can keep their cavity from getting bigger simply by brushing little fluoride, if you believe in fluoride, and just making sure that it doesn't progress. A cavity is officially a cavity when it gets into the dentin. That is officially a cavity. So actually in the x-ray, you can see like this wider portion, and then it gets a little, we say it's radiolucent. Sorry, I'm reading comments at the same time. So when it gets into dentin, you officially have a cavity. If I have a patient who never gets cavities, like have very few cavities in their mouth, and they have incipient decay, I don't necessarily tell them that they need a filling. And if they're regular, they come on a regular basis, because that means I can find the cavity, I can catch the cavity before it goes any further, or I can just watch them, make sure that it doesn't. I don't put watches on teeth very often because I don't like that. I don't want to watch a slow car crash, but I have to make sure that it's not going to. Now, if you're a regular person that I see all the time, I don't get worried about you because I know I'm going to see you before it even changes even a little bit. Now, once it gets into dentin, it is officially a cavity. And once it's officially a cavity, we need to treat it. There is no sense in waiting until we see that cavity go into your nerve and contaminate your whole body, then you need a root canal or your tooth gets destroyed. And listen, pain is a gift, okay? Pain is a gift. And what I mean by that is if you have pain, then your body is telling you something is wrong. But if you don't have pain, how on earth are you going to know something is wrong if you're not at the dentist? So even though people don't understand that they don't want pain, but pain is important. I had a patient yesterday. I think I'm going to do a video about this, and she had a fistula. Fistula is basically a pimple on your gum where pus comes out of. And I know that sounds disgusting, but that is basically your body's way to get rid of infection. People with fistulas do not have pain because instead of your face swelling up, what happens is all of the stuff leaks out of that little pimple, and you swallow it, and it's not good for your body. But that leak causes you not to have pain. So if you have a fistula, some people, they pop that little pimple on a regular basis to keep the pain away, which is not good because they're just ignoring a problem that just gets bigger and bigger until one day that fistula continues to the point that your face blows up, or you do whatever you can and nothing works. You still got to take the tooth out, or you still got to treat the abscess with a root canal. You do not treat dental abscesses with antibiotics. Dental abscesses are not cured by antibiotics. Dental abscesses can be allayed, can be pacified by an antibiotic, but will not be cured. You have to treat the real problem. If you don't treat the problem, it will come back and haunt you with a vengeance, and come back in the most inconvenient time of your life, the day before you're going on a vacation, right when you're out of town, or right on Sunday afternoon when all the dental offices are closed. That's when bad things happen to people's teeth. I'm telling you, I hear it a million times. If I need the root cleaning, can you tell me what is the number of my periodontal pocket, or is that not related to? That is actually a very, or is that possible for you because you can't see my teeth? Okay, so, and somebody's going to ask me another question, which is a great one. So here are the numbers, dear. 1, 2, 3. So I was looking around again to see if I found something. So let's imagine a ruler. Okay, 1, 2, 3 millimeters are good. We don't want our little ruler to go into your gum, between your tooth and your gum. Sorry, I'm listening for people talking. Between your tooth and your gum. Sorry about that. I keep thinking I hear somebody talking, but maybe not. Between your tooth and your gum, 1 to 3 millimeters is good. Then when you get to 4, we have some inflammation. We got a little problems. Usually some people with gingivitis have some 4 millimeter pocket, right? 5, now we're not happy. 5 millimeter pocket, that means that little instrument is sliding deep down. That means we don't have bone. 5, 6, 7, 8, 9, 10. I've buried a whole instrument in somebody's gum before. That is not good. So I can't tell you what your pockets are because you have literally 6 numbers per tooth, okay? The 3 sides on each side. So, and I can do a video about that, periodontal pockets and numbers and stuff like that. And that varies. Some people have it everywhere in their mouth, and some people in certain sections. Usually the molars are worse. The further you go back, the more chance you have a lot of plaque buildup, and then you have to do deep cleaning. So those are the numbers, right? I don't know what your numbers are, but make sure you ask your dentist, because in a couple months after you've done your deep cleaning, you want to know if you've gotten better. Did it get better? Did your numbers improve? Did they shrink? Now, sometimes our goal is not for your numbers to get better, is for them not to change, because if they get worse, that's bad too. Kitten asks, what are your thoughts on oil pulling? I have that's one of my first videos, probably the highest number of views I've ever gotten is about oil pulling. I actually plan on making a new video about oil pulling, and I'm going to add some CBD oil to it because I love CBD, and oil pulling and CBD is awesome. I recently, because I was preparing to do this video, started doing some more oil. Last time I got made fun of by the way I say oil. I got some oil pulling. I've been doing more oil pulling with coconut water lately. If I can't give you all the things I believe in about oil pulling, that it whitens your teeth, that it helps with gum disease, that it freshens your breath, all of the things that it helps prevent the bacteria that grow in your mouth. There's a lot of positive benefits to oil pulling, but my number one suggestion with oil pulling is your technique. And there's nothing I can write to say that except to demonstrate it. So if anybody thinks I'm a weirdo for doing it this way, this is just what it is. You have to imagine the oil going into your gums and coming up and out. So imagine this kind of swishing action. And of course, this lovely delay I have on this live is making this look weird. So it's like you're going in and pulling out. So imagine it just going in and out, in and out, in and out. And that's what you want to do. You want to draw the oil down into your gum and pull it out so it can pull that bacteria and clean your teeth. I don't know if it whitens my teeth, but I always feel like my teeth look whiter when I'm done. I don't know. I experiment with myself all the time. I have a lot of at-home things that I do to try to keep my teeth healthy and clean. No, I've never had braces. From North Dakota. Okay, that's not that far. You're not in Israel. You're from North Dakota. Lopez says, I'm scared of wisdom teeth extraction due to dry socket. Are there chances small? Okay. If you don't smoke, you're 25. If you don't smoke, your chance of dry socket is very low. Most people think that smoking is what causes dry socket, but it's not the smoke. Dry socket. Man, you guys give me such great video ideas. Dry socket is caused by the pulling action on the socket for you losing the clot. Imagine, I just want to draw a picture for everything, by the way. Imagine you have a tooth taken out and you have an empty hole. When you have that empty hole, your body wants to put a blood clot to fill that empty hole to heal you. All of the good things in your body, it's already there. It's already there. I'm not going to go into all the factor K and all that stuff that happens, but your body is putting fibrin and all those things to fill that hole. When you smoke, what you're doing is you're pulling at the socket, and that clot that wants to form cannot form. Not only you're pulling out it, you're drying it out. So not only is smoking bad to prevent, that causes dry socket, but any spitting, rinsing, or swishing. I tell all my patients, if I give them a whole paper of do's and don'ts and do this and don't do that when you have a tooth pulled, my number one tip is leave it alone. If you leave it alone, it will heal. Your body knows exactly what to do. Dry socket is an empty hole that has no clot. It has no clot. Most of my patients who have extraordinary, more pain than normal after extraction is they're doing too much. It's not that they're not doing enough. They're doing too much. They're rinsing, they're gurgling salt water. They're doing this, all this stuff, especially Listerine. Forget Listerine. Listerine should not be in your mouth when you have to do with after an extraction. Leave your mouth alone. Don't touch it. Don't expect it. Don't look. I stole this from one of my periodontists. Say no looky-loo. Leave it alone. The more you do that, the more you bother it, the slower you will heal. Now, one of the things you do have to do, which nobody mentioned, is trismus. So, Sopez, if you're considering that when you, hi Femi, when you have any teeth pulled, your tendency is to start talking like this because you're afraid that everything hurts and you want to make sure. I hope everybody understood what I was saying. You want to make sure it doesn't hurt. But what happens is people start doing that, and then imagine in a few weeks, you're like, man, I feel better and I want to yawn. Oh my God, I can't eat. I can't eat my sandwich. I can't get anything in my mouth. And that is simply because so imagine if this was your arm and you stayed like this for 2 weeks. When it was time to extend your arm, do you think your arm is going to want to come out, or it's going to be like, Urgh. One time I fell and hurt my knee and I kept my knee bent. When it was time to straighten my leg, I had to do physical therapy to open it. So imagine people with wisdom teeth, they have their wisdom teeth taken out and then they're like, oh my God, I need to go. So we tell them, you have to practice. I tell them, you have to practice. I don't want to give people muscle relaxant because literally you cannot function on a muscle relaxant unless you're a superhero and drugs don't affect you. But literally, you kind of measure. Most people should be able to get 3 finger widths. I know that looks awful, right? 3 finger widths into their mouth. They should be able to open their mouth that wide. So what you do is if you get stuck, you start with 1, you exercise it till the point it hurts. Then you exercise 2 until you get your mouth open again, massage and open. I hope that made you feel a little better, Lopez. I wouldn't worry about it. Most of the things that happen are very rare, especially dry socket. I almost never diagnose somebody with dry socket just because I don't believe it happens that often. People just run to it because they don't understand why they have pain. There is something called dry socket paste. Dry socket paste has eugenol in it and some other nice, smelly, delicious is brown. And your dentist can put it in there, but it doesn't matter what the dentist puts in. You have to wait. And it's better not to get dry socket than have to treat dry socket because it's a pain in the ass. Oh, I said a bad word. It's a pain in the butt. And because it's a pain in the butt to get rid of because it's so painful, even with medication, even narcotics, it's better not to do it. Any other questions? Every time I threaten to like end the live, somebody asks another question. I'm like, oh, hey, okay, well, I have another question. I keep hearing sounds. I'm a woman. I'm always listening to the sounds in my reassuring. Good. Please let us know in the comments later how it goes, if everything goes bad. I actually like it when everybody comments about dental procedures they have had done and if my videos help them to make them feel a little better in any way. Somebody's been told they have TMJ. So do me. I mean, I would say, if I had to guess, I would say about 80% of the population has TMJ or some sort of clenching or grinding their teeth. I mean, I don't know, unless you're retired or you just have a stressless life. Most of us struggle with some sort of, sorry about that. Most of us struggle with sleeping. Most of us struggle with stress. And if we're struggling with stress, sleeping, and I have pretty vivid dreams, the more you're going to you doing one of these in your sleep, or clenching or grinding your teeth? I would say clenching is more common than grinding. That just means, and a lot of people do it during the day. They are in the daytime, they're thinking about something. And I tell my patients all the time, even me, like sometimes I have my mask on and I'm thinking really hard about something, and I'm confirming, so my teeth are clenched together. If anybody's, for the dentists out there, if you know how many milliseconds your teeth actually make contact, pay attention. It's a really cool little thing. Think about it. When you're talking, do your teeth touch? When you are eating, do your teeth touch? No. Your teeth are actually not touching when you're eating. Your teeth are grinding against the food. And when you're speaking, your teeth are not touching. So when you put your teeth together for extended periods of time, you will damage. A person earlier asked me about cracked teeth. The majority of cracked teeth come from clenching and grinding. It's not, nobody's out there eating rocks. Yes, people eat ice and bite on pencils and do things you're not supposed to do. But the majority of the damage we do to ourselves happens with our own teeth. Viola says, thank you so much. I wish I was closer. Have a good evening. Thank you, Viola. The messenger says, blessings. Thank you. I take all the blessings. I receive it. Thank you. Yes, so Sopes says they're going for IV sedation. IV sedation is awesome. I talked about it earlier with precaution. If you have an experienced person, there's nothing to worry about it. All the people that I know who have IV sedation, they go in and then they're home and they don't remember a thing after. They don't remember a thing after. I remember everything about my wisdom teeth experience. I was 19 years old when I had my wisdom teeth taken out. And at the time, the dentist was literally on top of my chair, like on top of me. And I mean, I was pretty traumatic at that time. I already wanted to be a dentist. I was 19 years old. I already wanted to be a dentist. I was already in college. And it was pretty, it was pretty traumatic for me, but I still wanted to be a dentist after that. Yeah, you're not going to remember. You're not going to remember. At the time you're doing it, and I said this earlier, they are going to think, hi, Kathia. See you on Friday. But at the time, they're gonna think, when they're looking at you, they're gonna say, open your mouth, you're gonna open, close your mouth, you're gonna close. All of those things are happening. You shouldn't tell the oral surgeon this, but I think oral surgeons do IV sedation because they don't have a good chairside manner. I know that's not nice to say. If I have any oral surgeons watching here, don't get mad, because they don't have to deal with people. Me, I have to talk to people. I have to calm them down, on a regular basis. But if the person is asleep, you can do whatever you want. Me, I actually have to interact with you because you're awake, So the recovery is a lot different when it comes to that. Anybody else? Anybody else? All right. I think I got through all my my ASMR. I filmed in this room, which was pretty awesome. I had a really good time. You're welcome. So King David says, my kids' 3 front teeth are ruined from apple juice and refuses to stay still at the dentist. Throws massive tantrums, very scared, hits and kicks. Is it worth getting caps on them, or should I? How old is your kid? How old is your kid? It depends, because one of the first teeth you lose are the front teeth. So listen, I don't like to traumatize children. It is not my preference to treat kids and make them hate the dentist because of me. That is a very big deal to me, because I see people all the time. Your kid is 3. Oh, your kid is 3. So they have a couple more years of those teeth. Then he or she might need to be sedated. Almost 4. Yeah, it's not time yet, because if he hasn't lost the bottom, so he's going to lose these 2, then the laterals, the side 2, and then the top 2. My youngest daughter is 5 years old, going on 6, and she just lost her second lateral. My oldest daughter, who is 9, lost her teeth a lot earlier. So everybody's a lot different when it comes to how fast, but it's not going to happen for at least 3 or 4 years. So yes, it is worth fixing. I do make that judgment all the time with kids. And I say, you know what? That tooth is going to fall out within the next 6 months. But I tell parents, you're on a timeline. If in this many time frame, that tooth hasn't fallen out, we have to do something. We like pull it or something. But we also look at the x-rays to see how close the next tooth is. So King David, when you talk to your dentist, ask them, do you think that this tooth is going to come out soon? Now, there's a lot of little kids. Actually, I have 2 of my nieces literally fell and their front tooth turned brown front tooth, like I said, but it's on little kids, which is even more disturbing because you know they're not going to lose that tooth for a while. Should I just let the new ones grow in? Yes, but if your son or daughter is in pain, don't wait. But if they're not in pain and they're just chipped or they have very small cavities, you can wait, but you need to be very diligent in following the dentist and seeing. I mean, if sedation is not an option, then it's something that you should at least have a plan. Do you know what I mean? Like, don't like just say, oh, I'm just going to wait till the teeth. Talk to your kid. Make sure that they're not in pain. Kids do not talk about pain the way adults do. They don't, especially if they know they got to go to the dentist. They're like, I'd rather this blow up, but they don't really know what the consequences are, right? It's like, you know, you have to determine that for your kid. Like if it's best for them or it's, you know, is it something that is worth pushing? So I would say if sedation is not an option, make sure you at least know, okay, if it gets to this point, we have to do something. Or if it's like, oh, it's not that bad, it's just a little, like you need to get the degree of how concerned you should be because the last thing you want is for an infection. What is my favorite subject or favorite thing in dentistry? I get this question all the time. My favorite thing in dentistry is implants. I like surgery. I like to cut. I like to do things. I like little challenges like that. I like cosmetic dentistry, but I like surgery a lot. If I wanted to go to 4 more years of dental school, then I would have been an oral surgeon. But I didn't want to go to 4 more years of dental school because you go to medical school also and oral surgery school. So some schools are 4 more years after dental school, and some schools are 6 more years after dental school. I would have been almost 40. He's huge for his age. Thank you so much. He's not in pain at all. They're just really worn down from juice. Oh, if that's all it is and they're worn down from juice, you leave it. If it's only a cosmetic, if it was my kid, I'd leave it. I mean, if it was my kid, maybe I would do it myself. My daughter's a really good patient, but my second one, she doesn't even want to get a cleaning. Man, it's hard to deal with these kids. It's not that easy because you're forcing them to do what's, you know, something that's what's best for them, but they don't necessarily agree. They don't necessarily see it as beneficial. All right, I'm at 42 minutes, so I'm going to start winding it down. As most of you know, I have a family. I have 2 kids. I have a husband. I have people to take care of at home who are expecting me to go and make some dinner. So I got to wrap this up soon, but I'll take one more question if anybody has one. I really like when people kind of show up and participate and talk. It makes me very, very happy. So always let me know. I'm not mobile because I'm on my laptop, but I was going to show you guys some of my stuff in the operatory and stuff, but I guess you can't see everything. But if you want to see my office, you can always watch my last live. Was it last week or the week before that I did the one outside? Oh, Christ is King. Amen. All right. And I'm wearing this is actually my sister's birthday shirt that when we went for her birthday. So I zipped that up. It's actually cold in Florida. All right. So thank you once again, everyone. Make sure if you're not subscribing, I'm pretty sure all of you guys are subscribers because I see your names all the time. You guys are also, I know there is lighting on top of me, but this is my, maybe that would have helped me. Maybe that would have helped me if I had put this on. Oh, let there be light. Thank you, Adir. I need you in my life to let me know when I had this the whole time to make the lighting better. I usually have my ring light when I'm doing live at home. All right. So thank you again. Have a wonderful day. Make sure you comment on this video if there's a question that you didn't feel, if you ever not want me to say your name, I can always do that, but make sure that you comment below and I always respond to everyone, as many as I can. Stay tuned. I have a lot of really cool ideas for videos coming up. I honestly cannot produce them and edit them fast enough. And that's really what my thing is. I would like to make some procedural videos, just because in general, people like to see what they're going to go. If anybody has any procedures, that's how close I am to my instruments right now. If anybody has any procedures that they have coming up and want me to do, I pretty much have a video about just about everything. But if there's any procedures that anybody has coming up and wants me to do a video about that procedure, I know it makes me feel better. Whenever I'm going to go do something, I like to know what on earth I'm going to do, because it's scary. It's scary, especially dentistry. But I'm here to tell you, don't be scared of the dentist. We can take care of you, or at least I can. All right, everybody, have a wonderful day. Thank you again. I always like to give by Rock Simmer, by Adir, by King David. Thank you, Slopez, Hi Thea, The Messenger, Viola, Mitch, Mitham, Cubs fan, Rock Simmer. Good night. Have a good night.